Getting a serious diagnosis is it's overwhelming. And trying to figure out the medical world on top of that, it just makes everything even more confusing. So today, we're going to clear up a really critical question. What's the difference between a medical oncologist and a hemato-oncologist, and how do you know which one is right for you?
When you're facing a diagnosis, this is pretty much the first hurdle. You just want the best expert, right? But it's not always clear who that person is. It's a really anxious place to be, so let's try to clear up that confusion and help you find the right path forward.
Okay, here's our game plan. We'll start by looking at these two kinds of specialists, then we'll break down the exact cancers they treat. We're talking solid versus blood cancers. We'll explore why the specialization is so incredibly important, and we'll finish up with a key procedure that makes the distinction crystal clear. So let's set the scene. In a lot of modern medical systems, and India is a perfect example of this, healthcare is super specialized. I mean, within cancer care alone, there are all these different expert roles. And while that leads to better care, it can feel like you're trying to navigate a maze when you're the one looking for the right door. And if you've ever felt that way, trust me, you are not alone. It's a totally normal part of this whole process. Our goal here is to cut right through that confusion so you can feel confident you're talking to the right expert for your specific situation. All right, let's introduce the two main players in this story, the medical oncologist and the hemato-oncologist. Now, it's important to remember they're both cancer doctors, and they very often work together as part of a bigger team. But for what we're talking about today, we really need to focus on what makes them different. Okay, so at the highest level, this is the big difference. A medical oncologist typically deals with solid tumors, a cancer that's in a specific organ. A hemato-oncologist, on the other hand, specializes in what you might call liquid cancers, the ones related to your blood, bone marrow, and lymph nodes. Let's dig into that a little more. This is really the heart of the matter. The type of cancer you have dictates the type of specialist you need. So let's look at some really clear examples. A medical oncologist is the expert you'd see for cancers in the body's organs. We're talking about things like lung cancer, breast cancer, and cancers of the kidney, pancreas, or mouth, just to name a few. Basically, if it's what we call a solid tumor, that's their world. All right, now let's switch gears and talk about the hemato-oncologist's turf. This is where we get into cancers of the blood and the lymphatic system. So you're looking at different kinds of leukemias, lymphomas, which are cancers of your lymph nodes, and also something called multiple myeloma, which you see a lot in folks over 60. So you might be thinking, okay, I get it, but why the big splits? Well, the reason is that blood cancers behave very, very differently from solid tumors. And because of that, they require a totally different game plan to manage them. And this quote right here just nails the urgency. You see, unlike a lot of solid tumors that might grow over a long period of time, blood cancers can just explode in growth. We're talking sometimes in a matter of days. And that speed, well, that creates a whole different set of problems. So what's happening here is this really dangerous domino effect, because these are cancers of your infection-fighting cells. Your whole immune system just gets thrown into chaos. And once that shield is down, the door is just wide open for some really nasty, serious infections to take hold. And this is such a critical point. Patients with blood cancers can get these incredibly serious infections, like aggressive fungal pneumonias, that you just don't typically see in patients with solid tumors. So managing these infections becomes just as crucial as fighting the cancer itself. So let's just boil it all down. A patient with a solid tumor, they need an expert in cancer treatment. But a patient with a blood cancer, they need that expert plus someone who is a master at managing a completely compromised immune system and all the infections that come with it. It's a whole different level of care, which is why they often need specialized isolation wards. The entire approach is just fundamentally different. Okay, now if there's one single thing that really hammers home the difference between these two specialists, it's a procedure you've probably heard of, a bone marrow transplant. So let's ask a straight-up question. Say you or a loved one needs an opinion on a bone marrow transplant. Based on everything we've just covered, who do you think you should call? Well, the numbers here are pretty staggering. In a country like India, a whopping 90 to 95% of all bone marrow transplants are done by hemato-oncologists. I mean, they are the absolute, undisputed experts in this highly specialized area. And why is that? It's because a bone marrow transplant involves these incredibly high doses of chemo that basically wipe out a patient's blood counts. We're talking down to almost zero. And managing a patient in that incredibly fragile state,
That requires the exact skills a hematologist uses every single day, dealing with low counts and fighting off life-threatening infections. So, to put it all together in one simple chart, your medical oncologist is focused on solid tumors like lung and breast cancer. The hemato-oncologist, they're focused on blood-related cancers like leukemia and lymphoma. And when it comes to bone marrow transplants, the hemato-oncologist is the primary expert, no question about it. So the big takeaway here is actually really simple. If the cancer is a solid tumor inside an organ, you want to see a medical oncologist. If it's a cancer of the blood, bone marrow, or lymph nodes, you need the specialized expertise of a hemato-oncologist. Simple as that.
Look, dealing with a health crisis is incredibly tough, but having the right information is a really powerful tool. And knowing this one difference is a huge first step toward getting the absolute best care. We really hope you feel more empowered now to take that step. Thanks so much for joining us.